we have to apply it with a skill. Okay. So all these things what we are doing is for the exactness and completeness in our prescription. So we are searching for the very specific, very accurate and very correct symptom through which we can prescribe for the patient their medicine very exactly and completely. So that is the main purpose of this software and searches. Okay. So what is the use of prescribing exact and complete prescription is that you will get a consistent result in our practice. So we cannot prescribe just for that. So that is one more thing. So the first thing is the creating a master rubric specific to the case. This is one unique option where you can create a rubric of your own with different combinations of symptom clusters as one by one using a connector option. I will show you the cases with the examples, right? So this is the global search window where you can search the symptom which is needed for us entirely. Okay. So here you have two options, one is repertory and the other one is reference library. You can limit your search to repertory, or you can have both repertory and reference library, or only for reference library. Whatever you need, the software will do. Okay. So this is called as a global search window. Here whatever the symptom we are going to give will be considered as the master rubric. Okay. So this is on very old case of mine where I have used this software for the first time. It's almost 10 years before. This is a case of a child about 2 years of age with a congenital megaureter and horseshoe kidney. So this case presented with a complaint of discharge of pus as urine. So whenever the child passes urine, only pus will come out. And while urinating, the child will scream and there will be very painful urging during urination. So due to this urging and irritation and pain, the child is constantly handling the genitals due to irritation. So this was the symptom presentation from that case. So how we can approach this case? Any idea? We can have a discussion. How we can approach this case?
You want to take the symptoms into repertory.
Yeah.
So first will
So
be
what are all the symptoms we can put into the repertory?
urination, pus, discharge,
Urination,
discharge of pus.
urinating, actually this particularly in this system the complete repertory has not been installed now. We can take Kent repertory, right?
Sir, urethra discharge search. Search as a discharge in urethra.
So first we try to directly go to the repertory for rubrics. Okay, then we can come to the search. Okay. Urination is in which chapter it is? Oxygen. So urination. Pus is not here. Where to search for the pus?
Discharge.
Discharge, dribbling, search for some other synonymous words, right? Okay. Any other synonymous word for pus? This repertoire is new to you all. See, when there is a confusion, we can use the global search window, right? But how to use it and what kind of words we have to put in this case. So before we go into the process of creating a master rubric, first we should have an understanding of the case, right? Okay. So how I understood this case was, the first thing is the child has a congenital kidney pathology, that is a renal pathology. Okay. Point number one. The second thing, the pathology is expressed through urine infection with pus, urine with pus. Okay. The third thing is the child has an urging in urination. These three things. Okay. So we have to find a remedy which has these three key points in it. Right? So what words can we give in this case as a search? Interrupt silence.
So we can search and see like in kidney congenital.
Kidney congenital. Okay.
Don't know exactly what it will be, but we can search and see.
Yeah. Okay. Kidney. Within 5 words. Congenital. Any other symptom to be added?
Urging.
Urging.
Screaming.
Screaming. We can give every five words. See, these three things are closely related with a particular organ symptom. So it can be searched within 5 words. So if screaming, that will be in the mind section or in the urinary section of the materia medica. So here we have an option like this. Either we can search in the same sentence, right? It is coming as sentence, right? SEN. So other thing are in the same paragraph. Okay. The other thing are in the same section, that is in the urinary section. Okay. The other thing is in the same remedy.
सर ये हम राइट करते हैं वहाँ पर या मीन्स ऑप्शन है?
It's an option.
ऑप्शन.
You can search within the line, within the paragraph, or within the remedy. It's an option. It's a fixed option. You can just choose the option.
Okay, this is in control keys or
It is in the space bar. If you just click the space bar, the options will be changing.
okay.
Only the within number of words. This is called the connector word. Okay, that thing that is connecting the symptom. That is a connector word. Okay, so we can have the screaming in the same remedy, right? Wherever there is screaming, it will pull up. Okay. Anything else? That's all. Okay. Go to cell phone. See, the software will do what we are giving, right? What command we are giving, it will respond. If there is no combination in this, then it will show no result. Okay. So we should be very wise while giving the keywords for framing the master group. Okay.
Urine urging
Hmm.
discharge. 5 words discharge.
Urine urging discharge. Yes, your keyword covers all the three key points of the case.
No.
What is missing?
Congenital.
Yeah. So the keywords what I gave. Urine, 5 words pus, within 5 words kidney. Okay. Urine, pus, kidney. Single remedy is Capacel, that too in the nerve report. Okay, so the nerve report is one of the very most reliable report. So you see the symptom here. Urine contains pus with painful urging in kidney diseases. So it covers the pathology, sensation, location, everything, right? So this child was given Heparself some 10 years before this case came. So given, and the child was completely recovered from the urinary tract infection. The congenital anomaly could not be recovered by the remedy. Okay. So this is the first case which I remember that I have used the software for this master group research. Okay. The second thing is reliable report. Okay. So as we already discussed, the reliable repertory is a unique repertory which has been recently formulated, recently compiled. Okay. So it has all sorts of recent researchers and recently clinically verified rubrics and everything. Okay, all the proving symptoms and clinically verified symptoms alone will be present in this rubric. Okay, so this is the second case. So it's a case of breast cancer. It's almost the final stage. Here we cannot expect any cure, but we can give some palliation for the case. Right? So the patient was presented with a very intolerable pain. Actually, this case was coming for this cancer issue for the past 10 years. So it had occurred 10 years before, and we treated, the cancer has been cured, the tumor has been reduced to size, but again it recurred after 3 to 4 years. The patient didn't follow for the next prescription. Then the third recurrence occurred. After the third recurrence, it does not regressed. It started prognosing. Okay. She went for chemo and everything. So this is the current stage now. Okay. So the complaint of the patient was there is a continuous discharge in the cancer tissue with much offensive odor. Okay, very much offensive odor that is smelling the entire home. So no one can go near to it. Okay. So this was the complaint. So I have to prescribe the remedy for this symptom. If a case like this comes, what we generally think of? So there are many remedies for breast cancer, right? At the end stage we have. So any examples? Just say. This is not an exam. You can speak. Any cases, any remedy for the breast cancer? Onayam, Shirlina, Celicia. kind of remedy we need for this case? How we can understand this case? So if we are going to prescribe a remedy, that remedy should cover the key features of the case, right? So what kind of remedy we can take in this case? So I understood the case just as we do. So when we search with commonly used rubrics, we may get more choices of remedies, right? And sometimes it may be difficult to choose the remedy in such cases where we have the predominated pathology. The pathology is predominated already in the case. You cannot go further with other than the cancer remedies, right? Okay. So what we do? Just observe the image. Do you find anything characteristic or indicative, or something which you have noticed something uncommon in this image? Tell. Speak.
If I tell it might be funny, it's like mouse.
Mouse. Mouse. Yes, right, okay. Mouth open like.
Yeah.
Okay. Then observation.
Discharge.
Yes, there is a discharge. White pustular discharge is there. Okay.
Multiple small growth.
Multiple small nodules are there. Okay, fine.
Red color, reddishness in the center and surrounding the color is changed.
Yeah.
Dark color.
Okay, fine. Good. Then, have you ever seen a ulcer like this, a cancer ulcer which has a cleft in the middle? It is like that of you have just kicked it with an axe, right?
Yes.
So if it is well and good if you get a remedy like this, no. So where to search it and how to search it? So if you go to repertory, right, you can take the Kent repertory. Okay, what we can do? Chest. What we can take in such case? எல்லாரும் ஏதோ பேசுனீங்கன்னா தானே நானும் ஏதாவது சொல்ல முடியும்.
Sir, chest ulcer.
Chest ulcer. Yeah.
Discharge.
Chest ulcer. See, you have mammary here, right?
Yes.
Shearus, which is cancerous, stinging, burning, odor of old, which is Hepar has been given in Kent. Shall we prescribe Hepar?
Foul smell.
Foul smelling. See, anything that could not be traced out in the particular location, we can just go to the generalities and we can look for it. Okay.
Offensive smell.
So in general, there is cancerous affection, right? Pardon? Offensive. Yeah, see, serous type. Serous, which means ulcer, right? Okay. Then discharges offensive, right?
Yes.
There is no discharges in general case.
Shall we take in skin chapter discharge?
Yes, that's the thing. You will have a cross cross reference in this. Okay. That is what you can do. You can go to the preference, repertory setting. In the view setting, you can just have this cross reference. If you select this, then you can get the cross reference here. See, discharges, there is cross reference, different section, ulcers. So if you go to ulcer, it commands us to go to skin. Okay. So either you can take it in skin or you can directly take there itself. Okay. Ulcers, again cancerous is there. So if you do this, what remedy comes in? Coneyum, right? So but whether coneyum covers the
No.
no. So what we do? What we do now? We have to go to the global search window, right?
Yes.
Yes. So before going to the global search, we have to have an understanding of the case, and we should be very sure of the keywords what we are going to give in the command box, right? This was the keyword which I gave. Just simple keywords. So breast or mammy. In repertory or in reference word, our Metamerica will have these terms, right? Breast or mammy. Within 5 words, cancer or ulcer, then offenses. These are the very key points in the case. Okay. Breast, mammy, within 5 words. Cancer, or this is or. You can give this command like this, okay? Or ulcer, that is offensive, right? First I got this search, okay? This result, that is chest cancer, mammy, ulcerated offensive is Condorello. Okay? When I just go into this rubric, okay, see here, chest, cancer, mammy, ulcerated, offensive, okay, see below it, by a ragged cleft. Both these symptoms are covered by Condorello. Okay. And this rubric is present only in the labeled repertory, and none other repertory has this symptom. So when we come across such a symptom and such a remedy and anything, we should find who is the author, who is the source and everything. Okay. So we need to have a ready reference for that, right? Have you ever checked with those things? Who is the author? Where is the source this rubric has taken from for every case? So that is one important thing we should do in every case. Okay. See, when you just you need to find the author, you can just all authors name. You will get the author name below this, which is Andy Saini. All these 4 rubrics have the author name as Andy Saini. So he is one of the reliable author. Have you ever heard of Andy Saini? So he is a renowned filmmaker who is very well in treating the psychiatric cases. Okay. But you all feel sleepy. So Condorogo was given to this case and the offensiveness and pain has been reduced. But she has same suffering. So Condorogo 30 in water dose and 200 last week, maybe next week 1 hour. Okay. So the third thing is the case analysis with reference work filters. The reference work is